Welcome again to Impact Med. My name is Dominic, and today we are going to learn about IUD or intrauterine contraceptive devices as a method of family planning. If you haven't watched the other methods of family planning, you can scroll down to my other videos on my channel, and please subscribe to my channel to learn more on healthy tips and healthy conditions and more on healthy topics. Welcome again. So what are IUDs or intrauterine contraceptive devices? So copper ring IUD is a very long-term pregnancy protection plan. Actually, it has shown to be very effective for 12 years, and it's immediately reversible. So it's usually inserted into the uterus by a specifically trained provider. As you can see, these IUDs and the implants, they need a trained provider actually. So little is required of the client once the IUD is in place. So there's nothing that intervention that is needed once it is placed. There's usually bleeding changes which are very common. There's also typically longer and heavier bleeding and more cramps or pain during monthly bleeding, especially in the first 3 to 6 months. So when it has been placed, especially the 3 to 6 months, there's usually a heavy bleeding and cramps which are common. So how effective are the IUDs? So one of the most effective and long-lasting methods actually of family planning. So less than one pregnancy per 100 women using IUD over the first year. So a small risk of pregnancy remains beyond the first year of use and continues as long as the woman is using the IUD. Over 10 years of IUD use, also about 2 pregnancy per 100 women as shown. So that's how effective the IUDs are. What are the side effects? So some users have reported the following. So changes in bleeding patterns, especially in the first 3 to 6 months, including prolonged and heavy monthly bleeding. There's also irregular bleeding. There's more cramps and pain during monthly bleeding. So the benefits of IUDs or IUCDs: there's a risk of pregnancy, helps protect against risk of pregnancy. They may help protect against cancer of the lining of the uterus, which we call endometrial cancer. Non-healthy risks, which are very uncommon. So it may contribute to anemia if a woman already has low iron blood stools before insertion, and the IUD causes heavy monthly bleeding. So because of the heavy monthly bleeding, it can cause anemia. So there are also those healthy risks which are rare, which is pelvic inflammatory disease may occur if the woman has chlamydia or gonorrhea at the time of IUD insertion. So yeah. We also have complications which are also very rare. They may be puncturing. So there is complications which are rare. So they may be puncturing or perforation of the wall of the uterus by the IUD or an instrument used for insertion. So they can puncture when they're inserting, but which is rare. Usually heals without treatment actually. So when you punctured, it can heal without treatment. So another complication is miscarriage, preterm birth, or infection in the rare case that the woman becomes pregnant with the IUD in place. So let's correct a misunderstanding about the IUD that you may have known, the myths and misconceptions. So the IUD, they rarely lead to pelvic inflammatory disease. They rarely actually. It's not a must that once you get an IUD that you'll get a PID. No, it's very rare. So they do not increase the risk of contracting STIs, including HIV. They do not also increase the risk of miscarriage when a woman becomes pregnant after the IUD is removed actually. So they do not make a woman infertile, and they also do not cause birth defects. They do not cause cancer. They do not move to the heart or brain as one of the myths. So they do not cause discomfort or pain for the women during sex. Substantially, they reduce the risk of ectopic pregnancy. So the reason why some women prefer IUD is that it prevents pregnancy very effectively, and it's long lasting actually, has no further costs after the IUD is inserted, so does not require the user to do anything once the IUD is inserted. Those are one of the reasons why some women prefer the IUDs. Thank you for watching this video until the end. That's all about IUDs, and please subscribe to my channel to learn more on family planning methods. And if you haven't seen the other methods, please scroll down at my channel and you're going to learn more on the other methods of family planning. So see you next time.